Hello. So today we'll be talking about the second session of the Focused Point of Care Ultrasound course, and we'll be talking about pneumothorax. In the first session, we've talked about the basic requirement for doing lung ultrasound, including the technique and the A lines and B lines and their difference. And today we'll be concentrating on one pathology, which is the pneumothorax. So the objectives of today of this session talk about introduction, then the importance of sliding sign, and then we'll talk about the very important sky, ocean, beach sign, or what we call it barcode sign, and we'll be also describing some mirror image, what we call it mirror image sign and track sign. So as an introduction, the studies have found that lung ultrasound is superior to X-ray in diagnosing pneumothorax in patient who's lying in bed. The sensitivity of the X-ray reach about 75%, but has a high specificity of 100%. However, the sensitivity of ultrasound is much better than the X-ray in doing ultrasound, about 98%, and the specificity is 99%. The difference between the X-ray also that the ultrasound can map the pneumothorax and have multiple view and live, and also we can have a continuous dynamic serial studies. So how we look for pneumothorax, we should start in the second intercostal space at mid-clavicular line, and trying to place our transducer a little bit away from the heart. It's better to put in a vertical orientation than alongside the ribs. We need to assess about 4 to 5 respiratory cycles. We need to find the pleural line and to see the sliding, the lung sliding. We have to see also the mirror image of the ribs, and we have to see the sky-ocean beach interface when we put on M-mode. So sliding sign is the sign that allow you to see the movement of the visceral over the parietal pleura. So try to avoid the artifact movement of the chest, or during if the child or the baby on ventilator, it might interpret that the viscera is moving, but concentrate on the sliding and especially seeing the B lines going and coming back. So we can see here that there is a movement. If you can see, there is a movement, and it's vital when to check this type of movement is to increase the image and optimize the gain, and take a close-up view and look at the movement of one part of the pleura over the another, and try to ignore the other macro movement due to movement of the probe of the child, or due to ventilation, or due to respiratory movement. So we look to the pleura, and we look to the A lines. And if we remember from the first session, the presence of A lines, the transverse reverberation of the pleura, means two things, either normal or pneumothorax. So when you see A lines, always check for sliding sign. So normal lung sliding, you can see the movement of the visceral pleura. Ignore the major movement, but concentrate on the movement of the lines below the pleura over the other pleura. While in pneumothorax, you'll see it as if dying. There is no movement. Also ignore the major movement of the chest and the baby, and during breathing. Just concentrate on the pleural line. And sometimes you can see what we call it lung point. So you can see that there is movement in here, but the movement stopped when it goes back to here. So it's the area between normal lung and pneumothorax part. So when there is absence of sliding sign, it's either pneumothorax, and if there is a pneumothorax, you have to see the barcode sign, or there is chest tube, or sometimes there is consolidation with pleural effusion. Or when there is pleural effusion, you will not see barcode sign. So how we see the sky, ocean, beach sign? When you suspect pneumothorax, you put your line of M mode, then you turn to a mode, and try to put it between the two ribs, and try to be perpendicular, your transducer on the perpendicular on the ribs, and take one picture and see the barcode sign. So try to see the seashore sign or sky, ocean, beach sign and barcode sign. So here you can see that this is sky, which represent the skin, and then you have the ocean, which represent the pleura, and then you have the beach, which represent the lung tissue. And when there is no lung tissue, you will see very frequent eye lines or reverberation of them, more frequent eye lines, and it looks like barcode. So you can see a barcode here and sky, ocean, beach sign, normal lung, pathological pneumothorax there. And you can see the lung point in here. And this is, you can see that normal lung, pneumothorax, normal lung. You can see barcode sign in here. You can see normal lung in here. You can see barcode sign here. Barcode sign clear here. Normal lung in here. And so on. You can see this is the rib. Barcode sign. And you can see normal lung and the pathological lung is in here. You can see it's moving, going back, and this is the pathological lung. Again, frequent eye lines, barcode sign, 2D views, M mode. Again, M mode, normal lung. Normal lung. You can see the sky, ocean, and then beach. And you can see the barcode sign, no movement here. When there is pneumothorax and there is mirror image of the ribs, and this is a big view, and then whenever there is a mirror image of anything, so there is air, and that's when there is air in the pneumothorax. When there is air in the pleura, it causes mirror image of, because the beams of the ultrasound, when it reaches the pleura and after that there is air, it thinks that somebody asked the image to be repeated. So start to repeat these images of the ribs on here, and looks like a truck. Another truck sign. And also we can see a mirror image sign. So whenever we see a mirror image, that means there is air. So you can see the liver here, you can see the diaphragm, and then you can see a mirror image of the liver on the lung side. So whenever there is mirror image, reflection of the liver, that means there is air. And by this, I conclude the second session of the lung ultrasound course, and which was about pneumothorax. We've talked about an introduction, and then we talked about barcode sign, sliding sign, and how to differentiate normal from abnormal lung due to pneumothorax and lung point. And at the end, we've done with the mirror image signs, which was 2. And these are the mirror image of the liver and mirror image of the ribs, or what we call a truck sign. Thank you very much, and hope seeing you in the third session.